Heart disease is the leading cause of death globally, and it can happen to anyone at any time. But what if there were signs that could warn you about it? Signs that could give you a chance to take action before it's too late. Today, we're going to explore the critical signs of heart disease that everyone should know. You might be surprised to learn that some of these signs are subtle, and you might not even realize they're related to your heart. But if you know what to look for, you could save your own life, or the life of someone you love. So, let's get started. Number 1, chest pain or uncomfortable pressure. When most people think of heart disease, they think of chest pain, and they're not wrong. Chest pain or discomfort is one of the most common symptoms of heart disease, and it can be a warning sign that something is wrong with your heart. But what does chest pain feel like? Well, it can vary from person to person, but it's often described as a feeling of pressure, fullness, or tightness in the chest. Some people say it feels like an elephant is sitting on their chest, while others describe it as a burning or squeezing sensation. What's important to remember is that not all chest pain is related to heart disease. It could be caused by something as simple as indigestion, muscle strain, or anxiety. However, if you experience chest pain that lasts for more than a few minutes or is accompanied by other symptoms like shortness of breath, sweating, or nausea, seek medical attention immediately. In fact, many people who have survived heart attacks say that they didn't realize what was happening at first and that they waited too long to get help. So don't ignore chest pain or discomfort, it's always better to be safe than sorry. Number 2, tingling sensation. Did you know that a tingling sensation in your arms, legs, or fingers could be a critical sign of heart disease? It's true. When the heart is not functioning properly, it can cause a decrease in blood flow, leading to a lack of oxygen to the nerves in your body, resulting in a tingling sensation. So, if you experience unexplained tingling or numbness in your arms, legs, or fingers, it could be a sign that your heart is not getting enough blood. This symptom is often ignored or attributed to other causes, like a pinched nerve, but it's essential to pay attention to it, especially if you have other risk factors for heart disease. Don't ignore any tingling sensations, talk to your doctor to rule out any underlying heart issues. Number 3, nausea or vomiting. Heart disease can also cause nausea or vomiting, especially in women. This symptom is often ignored or attributed to other causes, like the flu or food poisoning, but it's important to pay attention to it, especially if you have other risk factors for heart disease. Nausea and vomiting can be caused by a decrease in blood flow to the digestive system, leading to a lack of oxygen and nutrients to the stomach and intestines. If you experience unexplained nausea or vomiting, along with other symptoms like chest pain, shortness of breath, or lightheadedness, it could be a sign of heart disease, and you should seek medical attention immediately. Remember, early detection is critical when it comes to heart disease. So, if you experience any of these symptoms, don't ignore them, talk to your doctor and get the care you need. Number 4, unexplained shortness of breath. Shortness of breath is a common symptom of heart disease, and it's often ignored or attributed to other causes, like asthma or anxiety. But if you experience unexplained shortness of breath, especially during physical activity or while lying down, it could be a warning sign that your heart is not functioning correctly. Shortness of breath can be caused by a buildup of fluid in the lungs, resulting from a weakened heart, which is unable to pump blood effectively. This symptom can be a sign of a more severe condition, such as heart failure, which requires immediate medical attention. Number 5, heart palpitations. Have you ever felt like your heart is racing or skipping a beat? These sensations are called heart palpitations, and they can be a sign of heart disease. Heart palpitations are often harmless and can be caused by stress, anxiety, or too much caffeine. However, if you experience heart palpitations that are accompanied by chest pain, shortness of breath, or dizziness, it could be a warning sign of an underlying heart condition. Heart palpitations can be caused by a disruption in the electrical impulses that control your heartbeat, leading to an irregular or rapid heartbeat. This can be an indication of arrhythmia, a condition where your heart beats irregularly or too fast, which can increase the risk of a heart attack or stroke and even lead to sudden cardiac arrest. Don't ignore heart palpitations, talk to your doctor to rule out any underlying heart issues and take steps to keep your heart healthy. Number 6, dizziness. Have you ever felt like the room was spinning or like you were about to faint? Well, that could be a sign that your heart is not functioning correctly. Dizziness is often ignored or attributed to other causes, but it's essential to take it seriously, especially if it's accompanied by chest pain, shortness of breath, or heart palpitations. Think about it, your heart is responsible for pumping blood to your brain, and if it's not working correctly, your brain won't get the oxygen and nutrients it needs to function correctly. That's why it's crucial to talk to your doctor and get the care you need if you experience unexplained dizziness. Don't let heart disease take control of your life. Take action and keep your heart healthy. Number 7, cold sweats. Have you ever broken out in a cold sweat for no apparent reason? Well, it could be a critical sign of heart disease. Cold sweats often occur suddenly and can be accompanied by other symptoms like chest pain, shortness of breath, and dizziness. Cold sweats are a common symptom of a heart attack, where the body releases stress hormones that cause the sweat glands to produce sweat. The cold sweat sensation occurs because of the body's response to stress hormones, which cause the blood vessels to narrow, resulting in a decrease in blood flow to the skin. Number 8, extreme fatigue. Feeling tired after a long day's work is common, but extreme fatigue is not. If you find that you're always tired, even after getting enough sleep, it could be a critical sign of heart disease. Extreme fatigue is different from normal tiredness, and it's often accompanied by weakness, dizziness, and shortness of breath. Extreme fatigue can be caused by an underlying heart condition, such as heart failure or a blocked artery, which reduces blood flow to the body's organs, including the brain. The lack of oxygen and nutrients to the organs results in extreme fatigue, weakness, and shortness of breath. Now, I know what you're thinking. Everyone gets tired, and it doesn't necessarily mean I have heart disease. But extreme fatigue is a red flag that your body is struggling, and it shouldn't be ignored. It's time to listen to your body and seek medical attention if you experience unexplained extreme fatigue. Your doctor can help you identify the underlying cause and provide you with the right treatment plan to keep your heart healthy. Don't let heart disease take control of your life, take action, and protect your heart. Number 9, persistent coughing or wheezing. It may be time to take your health seriously. Persistent coughing or wheezing can be a critical sign of heart disease, especially when accompanied by shortness of breath, fatigue, or chest discomfort. Persistent coughing or wheezing can be an indication of congestive heart failure or a buildup of fluid around the lungs. In congestive heart failure, the heart can't pump enough blood to meet the body's needs, causing fluid to accumulate in the lungs, which results in coughing or wheezing. Number 10, family history of heart disease. Did you know that having a family history of heart disease can increase your risk of developing the condition? If you have a parent or sibling who has had heart disease, you're more likely to develop it too. While you can't change your family history, you can take steps to reduce your risk and keep your heart healthy. Your family history of heart disease doesn't mean that you will inevitably develop it. But it does mean that you should take preventive measures, such as living a healthy lifestyle, managing your weight, quitting smoking, and managing your stress levels. It's essential to work closely with your doctor and have regular checkups to monitor your heart health. Number 11, swelling in the lower body. Swelling in the lower body, such as in the legs, ankles, and feet, can be a critical sign of heart disease. Swelling occurs when fluid builds up in the tissues, causing them to expand and become tender. This condition is also known as edema, and it's often accompanied by other symptoms, such as shortness of breath, fatigue, and chest discomfort. This is because when the heart is not functioning properly, blood can back up in the veins, leading to fluid leakage and swelling. This condition is often seen in heart failure patients, as the heart cannot pump enough blood to meet the body's needs. Conclusion. Remember, heart disease is a serious condition that affects millions of people worldwide. But the good news is that it's preventable. By paying attention to the critical signs we've discussed in this video and taking care of your heart health, you can reduce your risk of heart disease and live a longer, healthier life. Don't wait until it's too late, start taking care of your heart today.